And so without further ado, I am excited to introduce our first presentation today, Growing Healthy Soil for Healthy Communities, an effective program for improving public health practice. And our presenter today is Kristen Champion. So Kristen, please feel free to share your screen and the floor is yours.
Okay, just a second. Sorry, screen, there we go. So yes, hi, I am Kristen Champion. Thank you all for logging on. I am currently a graduate student at the University of Milwaukee's Zilber School of Public Health. I am working on my master's degree in public health, specifically in the epidemiology track. This past summer, I was fortunate enough to have the opportunity to work as an intern for the City of Milwaukee Health Department laboratory under the lab director Sanjeev Bhattacharya. Today, I will be talking about one of the projects I assisted with, the Growing Healthy Soils for Healthy Communities program. This program started back in 2014 with grant support from the Medical College's Healthier Wisconsin Partnership Program. It worked within two neighborhoods in Milwaukee's north and south side, Lindsay Heights and Kinnickinnick, to engage with community gardeners with the goal of educating them on how to improve their soil conditions through workshops and reducing soil lead levels. In 2017, this program evolved into a low-cost service provided by the Health Department laboratory, making soil nutrient testing and lead screening available to anyone in the area. The process that the laboratory uses for the soil screening is depicted in the methods section, with the steps performed by community members highlighted in green and those connected by laboratory support in blue. This is the same process that is used for both the grant-supported program as well as the low-cost service currently in place. All community members have to do is collect soil from their yards and gardens, following the detailed instructions found on the health department's website, and then drop it off at the laboratory downtown. Once a sample is submitted, the laboratory staff determine the soil's conductivity, pH, moisture content, organic matter content, and potassium and phosphorus levels. These are all conditions which are more important for a successful garden. Lab staff also will screen for total lead concentration as well as the concentration of bioavailable lead, which is the lead that could potentially be absorbed by the body. These results sent to the community members with the explanations on what the results mean, how these factors contribute to soil health, and how to improve their own soil conditions. The bulk of my time at the lab this summer was spent going over the soil results collected and maintained by laboratory staff and analyzing it for trends in nutrient and lead levels. This light is the light blue portion on that methods section chart. For the purposes of this poster, I used only data from the grant-funded program. We first found the average values for each of the soil conditions. Conductivity, pH, moisture content, and organic matter content were all in the acceptable ranges. Potassium and phosphorus were both above recommended values. The state value for lead in soil, as recommended by the EPA, is 400 parts per million. Using retransform log values, the average total lead concentration was 210 parts per million, and the bioavailable lead concentration was about 110 parts per million. Over the 3 years that the grant program was running, 52 community members were able to screen their soil multiple times. So we had data available on initial soil conditions and the conditions that resulted after participation in the program. We wanted to see if there was a significant improvement in soil conditions and lead concentrations based on these 52 properties. The chart on the right shows the average log transform values of the initial and follow-up screenings. There was a significant improvement in 3 conditions: moisture content, total lead, and bioavailable lead. Moisture content increased from 22% to 27%. The total lead decreased from 270 parts per million to 160 parts per million, and bioavailable lead decreased from 150 parts per million to 90 parts per million. The change in moisture content is not all that remarkable. It could be due to the difference in climate, a change in the season, or that community members were watering their gardens more frequently. However, what is notable is that there was a significant decrease in both total and bioavailable lead after participating in the Growing Healthy Soils program. Further, this decrease occurred without harming soil conditions. Previous studies have shown that soil lead can contribute a significant amount to a children's blood lead levels. These results of the last formal survey of the soil lead levels in Milwaukee County was published in 1994 and showed that soil lead levels were above the EPA's recommended limit of 400 parts per million, especially in the central part of the city, putting many citizens at risk. This safety level was set well before research determined that there is, in fact, no safe level of blood lead and that even small amounts can affect health outcomes. With this in mind, Any significant decrease in lead in the environment, like that seen after using this program, should be considered a win, as it has the potential to mitigate at least one exposure pathway. As I mentioned in the beginning, following the success of the grant program, the Milwaukee Health Department Lab has been able to open up the screening program to all community members through their low-cost service. Since the service's inception, the laboratory has screened samples from over 350 properties from 59 zip codes all across Wisconsin. While these numbers are exciting, there is still room for growth. The map on the right shows the zip codes in Milwaukee County which have had soil samples tested, and they are highlighted in blue. In the future, the City of Milwaukee Health Department Laboratory hopes to continue to expand the soil screening service and, through community partnerships, increase outreach into those communities most at risk in Milwaukee and beyond its borders. I would like to acknowledge the support received from the City of Milwaukee Health Department Lab, the Lab program staff, and as well as the previous collaborative community partners that we had on this project. And I think that's all I have. So now I will take some questions.
Beautiful. Thank you for that excellent opening presentation, Kristen. So we have two questions coming up from the chat. So the first question comes from David Nelson. Thanks, Kristen, for this outstanding presentation. Good to see lead is going down. How do we grow this program to get more people to be concerned about their soil to take action in the future?
I think a big part of it is in the communities where soil or where soil lead is, really a problem. It's in the communities where there isn't a lot of disposable income. So trying to get partnerships where that can help fund more screening services for the people who can't necessarily afford it, I think would be a good starting point of how to help adjust it.
Perfect. And then in follow-up and kind of building on Dr. Nelson's question, what are the specific recommendations to improve soil health? And I might have missed that too. So we apologize if we missed it, but what were some of the remediation things that you all suggested?
I mean, it depends. It could just be a matter of mixing in, depending on what you're trying to improve. It could be mixing in different organic compounds to raise the pH and decrease some of the other stuff. And I think for the lead, it was more a matter of just mixing in a lot more fresh garden soil and trying to, break up the amount of lead that was really in there.
Okay. Wonderful. I think we have time for one more question or comment here. So Dr. Young is saying, this is great work, Kristen, especially as we encourage urban gardening as an option for healthy produce. Yes, indeed, Dr. Young. And yeah, thank you for your presentation, Kristen. I feel like I learned a little bit more about gardening today. So wonderful. Thank you.